This is from Men and Alcohol. Ask about alcohol.ie. In Ireland, most of the messages we hear about alcohol are positive, relaxing, having fun with friends, or rewarding ourselves in some way. We don't often talk about the negatives, but the risks are real. The more you drink, the greater your risk of alcohol-related harm. Alcohol on your health, physical health and fitness. We don't think about the calories in our alcoholic drinks the way we do with food, but a glass of wine or pint of beer can contain the same amount of calories as a bar of chocolate. Also, we often crave fast food and unhealthy snacks when we have been drinking, and additional calories can add up quickly. Apart from the obvious problems of trying to train or function with a hangover, alcohol affects endurance, muscle development and recovery. It affects how proteins are made, reduces muscle buildup and cancels the benefits of a workout. If your drinking is changing your body shape or affecting your performance on and off the pitch, it's time to cut down. Alcohol and cancer. Alcohol increases your risk of developing at least 7 types of cancer, such as mouth, throat, bowel cancer. Just as smoking doesn't cause lung cancer overnight, alcohol does not result in cancer diagnosis immediately, but it does increase your cancer risk 10 to 20 years later. There's no safe level of alcohol when it comes to cancer, but the less you drink, the lower your risk of developing alcohol-related cancers. Any amount of any type of alcohol increases the risk of developing cancer. Alcohol and liver disease. Drinking more than the low risk guidelines roughly doubles your risk of cirrhosis of the liver disease, and also increases your risk of liver cancer. Most heavy drinkers have a build-up of harmful fat and inflammation in their lives. Alcohol in your heart. Regular or high risk drinking can increase your blood pressure and leading to strokes, and may cause diseases of the heart muscle called cardiomyopathy. Alcohol and sexual performance. Heavy drinking reduces a man's fertility. It can cause impotence, not being able to get or keep an erection, reduce your sex drive and affect sperm quality. Alcohol and mental health. Many people see alcohol as a way to relax and de-stress. However, alcohol can make it harder to cope with day-to-day stresses. Less alcohol is better for your mood and your mental health. At first, alcohol can seem to be a lessen symptoms of low mood and anxiety, but continued drinking will cause these feelings to worsen and may increase your chances of developing dependence on alcohol. Your tolerance for alcohol increases the more you drink. So if you drink to cope over time, you may also need to drink more to get the same level of contemporary relief. Alcohol and personal safety. Men are more likely than women to engage in risk-taking behaviours after drinking. This includes drink driving or getting into fights. Did you know that alcohol is a factor in 1 in 4 deaths of young men aged 15 to 39 in Ireland? This is because many suicide, drownings and road traffic collisions involve alcohol. Coping with someone else's drinking. If someone in your immediate family is a heavy drinker, it can leave you and your children feeling unhappy, angry, scared, confused, guilty and unable to cope. If the person is violent towards you, talk to someone you trust and always consider your own and your children's safety. Men who are experiencing domestic violence should contact AM National Helpline. Gives a number, or www.amen.ie. Drinking guidelines. There is no safe or healthy amount of alcohol, but drinking with low risk guidelines can reduce the risk of harm. For healthy adults aged between 80 to 65, the low risk guidelines are currently: men, 17 standard drinks of 170 grams of pure alcohol or less a week. For women, it's 11 standard drinks, 110 grams of pure alcohol or less a week. One standard drink contains 10 grams of pure alcohol. One standard drink equals to half a pint of beer, stout of ale, or a single measure of spirits or a small glass of wine. Space and pace your drinking. Try to have at least 2 to 3 alcohol-free days a week and spend your drinks over the weekend. Drinking more than 6 standard drinks at a time simply increases the risk of your health and well-being. Spacing and pacing your drinking will also help you to avoid building tolerance to alcohol and forming a habit. But wine is okay, right? The reality is that your body can't tell the difference between different types of alcohol, such as wine, beer, or spirits. It's how much alcohol you drink that matters, not what you drink. Tips to drink less. Try to keep within the low risk weekly limits. If drinking at home, use a drinks measure to calculate how much you are pouring. Buy smaller wine glasses. A big wine glass can hold 2 standard drinks or more. Keep track of what you're drinking with a drinks diary. Note how much you drink, when, and how you felt afterwards. Try alternatively non-alcoholic drinks such as water. Don't get involved in rounds. This means you can drink at your own pace and stay more in control while you're out. Choose a lower strength drink, whether it is a wine or beer. Do something else. Try a fun, non-alcoholic based activity with friends. When it's not safe to drink at all, you regularly lose control of your drinking, or you find that once you start drinking you cannot stop. You are experiencing some alcohol-related physical mental health problems. You are under the age of 18. If you are unsure that whether it's safe to drink alcohol, check with your doctor or health officials. When it's not safe to drink alcohol, drink it all. That's this one for men and alcohol.